Hey, Dr. Shook here. Today I want to talk to you about why you really need to focus on calming down the immune system when you have Hashimoto's. So many people that have Hashimoto's are placed on a thyroid hormone replacement and the autoimmune process is completely ignored, and that is a huge mistake. And I want to share with you why that is and some of the things that you can do about it. When you don't address the autoimmune process that's driving Hashimoto's and you just go on a thyroid hormone replacement, the problem is that a lot of people continue to have symptoms. Now, it is common for people to go on a replacement hormone and within the first month or 2 months, there's a period of time, it's different for everyone, where they go through what we call like a honeymoon phase, where they actually feel better, because thyroid hormone is very important, and it does have an immune system modulating or balancing effect that can actually help the autoimmune process. And a lot of times you'll see that people feel better initially, but then their symptoms start to come back, and over time new symptoms develop. Now, some people, they get put on thyroid hormone replacement and they don't feel any better, or worse, they go to their doctor and the doctor says, hey, it's not your thyroid, but the doctor never even checked to see if they have Hashimoto's. They didn't look to see if they had thyroid antibodies, and those thyroid antibodies, they tell you if your immune system is reacting against the thyroid. So they are basically left undiagnosed, and because their thyroid is not yet destroyed enough to be placed on a thyroid hormone replacement. So these symptoms can often continue even when people get put on the medications, because they're not addressing the autoimmune process, and they can get worse. And this leads to poor quality of life and all kinds of negative consequences. Because listen, if you have low thyroid hormone, or you're not getting good thyroid stimulation of your cells, which increased inflammation that comes with Hashimoto's can do that, you literally age. It causes the cells to not be able to carry out their physiological processes optimally, and you will have advanced degeneration. And so it is a real problem that needs to be addressed, and something that you don't want to take lightly. Now, the second thing that will happen when you don't address the autoimmunity that drives Hashimoto's is that new symptoms that pop up, they often get treated with other medications. So, for example, something that's real common is that with Hashimoto's, there's often depression. And so you go to your doctor and you say, hey, I don't feel well, I'm depressed, and you explain, the symptoms that you're having. And they may say, well, you have a thyroid issue, let's check your thyroid. They check your thyroid and your TSH is within a normal range. They're like, well, it's not your thyroid. And they say, you know what? They'll come up with, you know, listen, your doctors mean well, so I'm not trying to be negative here at all. But let's just say they do everything they can. They try to counsel you, and they say, well, you know what? Why don't you take an antidepressant and see if that helps? So you basically get another medication for the symptoms that are very commonly associated with Hashimoto's and with the autoimmune inflammatory process. When you have Hashimoto's, you will have higher levels of inflammation. It is known to be part of the pathophysiology. Okay, so when you have higher inflammatory levels, the inflammatory proteins that are made by the immune system, they're called cytokines. Cytokines can cross the blood-brain barrier into the brain, and they disrupt your neurophysiology. They disrupt your neurotransmitters. They disrupt brain function. So depression is right now one of the most common areas of research, is this inflammatory model of depression. And for good reason, because it causes depression. Inflammation causes depression. So if you're not addressing the autoimmune process, and you're having these issues, it is a big gap. It needs to be addressed, because if you can utilize tools and strategies to help dampen the autoimmune process, and a lot of people can do much better. They can dampen the autoimmune process, and if you're lucky, put it into remission. So another symptom that comes up: elevated cholesterol. A classic symptom of a low thyroid is high cholesterol. Now, thyroid hormone replacement will a lot of times improve that, but people will still have issues with their cholesterol sometimes, even when they're on a thyroid hormone replacement. And there may be many reasons for that, other than just the thyroid, true, other than the autoimmune process. However, it could be, and is often, does play a role. So then they say, okay, your cholesterol is elevated, so they recommend a statin medication. And then another common symptom and medications that are recommended are laxatives for constipation. Constipation is extremely common when you're hypothyroid. Poor digestion, bloating, all those things are very common. So these are all things that you can often significantly improve when you start working on the autoimmune process too. Now, the autoimmunity, the third thing and the last thing I want to leave you with as far as some of these issues is that the autoimmunity can expand to other tissues like the brain. And this is something that clinically I've seen many times. A lot of the practitioners that I know that practice similarly to what I do, and a lot of the educators that I've learned from, like Datis Karazian, talk about this a lot because we often run expanded autoimmune panels. So we at least recommend them when we're working with people because you can run blood testing to see if there is, where else is the autoimmune process. And this is important because autoimmunity goes through three stages. Typically, stage one autoimmunity is where there are antibodies present against tissues, but there are no symptoms. Okay, so um, so this is the ideal time to catch it, is when you have antibodies in the blood, but you don't yet have significant symptoms, and there's not enough tissue destruction for it to be, blatantly obvious. Stage two is when you have antibodies in the blood and then you have symptoms, but there's not enough tissue destruction to know for sure with a lot of autoimmune diseases. And then stage three, which is usually 20 years later, when you could have been working on this for 20 years, you have antibodies present, you have symptoms, and you have significant tissue destruction. And so in an ideal situation, you want to catch this as early as possible. But especially with autoimmunity against the brain, this is something that happens more in Hashimoto's because the antibodies that your immune system makes, like when you get diagnosed with Hashimoto's, the doctors will check your thyroid antibodies. And antibodies are like tags that mark tissues as foreign. It's the immune system makes them, and it's a way that they can tag things that are foreign. The immune system can create these antibodies that tag foreign things, or the things that the immune system recognizes as foreign, and then other immune cells can very efficiently identify the antibody, the thing that the antibody has tagged, and destroy it. So in Hashimoto's, they check primarily thyroid peroxidase antibodies, or TPO antibodies. And those TPO antibodies, scientific literature, research has shown that those antibodies, those TPO antibodies, the ones that bind to the thyroid, to that enzyme in the thyroid, when they mix those and they check to see if they will bind or stick to other human tissues, they bind very strongly to cerebellar tissue, which is the back part of the brain. It's a processing station. It's responsible for balance, posture, walking. And when autoimmunity occurs against the cerebellum, it can cause issues with, it can lead to something like ataxia, where you can't walk in a straight line. It can lead to slurred speech, issues with focus. It can really create a lot of problems. And in the most severe form, it's called Hashimoto's encephalopathy. Now, this is something that could occur in people that have Hashimoto's. And, we'll talk about this in a second because I have a great diagram that will lay out visually for you a lot of these connections, which are really important that you understand because it helps. For me, I'm very visual, but it helps to make a lot more sense because you can see these connections. So that's what we're going to talk about now. So if you join me on YouTube or Meta, or anywhere that we've distributed this that's video, this is a great time to look at the screen, watch the video, because what I'm going to show here is what I call the Hashimoto's hypothyroidism and immune system web. Okay, so this is how the immune system affects the Hashimoto's and the thyroid, and how the thyroid and Hashimoto's affects the immune system, because they do have a relationship where they have influences on one another. So thyroid hormone levels, if they're low and you raise them, it will have an immune modulating effect. It will help the immune system. It will help you recover. Okay, so you don't want to be hypothyroid. If the immune system is is active and destroying the thyroid, obviously that creates a problem. So if you can dampen the autoimmunity in the immune system by removing triggers and supporting healing some of the key factors like your barrier systems, which we'll talk about in a second, that can that can lower inflammation, that can slow down, or if you're lucky, stop thyroid tissue destruction and improve thyroid function. So they are very interconnected, and every single person with Hashimoto's have this physiology occurring to some degree. Every single person. So this is one of the most important. I'm going to do other videos on other interconnected systems, because Hashimoto's is a multiple system disease. It is not it's not a thyroid disease. It's an autoimmune process that incorporates and involves multiple systems of the body. Obviously, it involves the immune system. Obviously, it involves the endocrine system, because your thyroid is an endocrine gland. So those two systems are involved. But it involves the gastrointestinal system. It involves it involves many different systems, and there are overlapping interconnected webs of physiology that, if you understand, at least to some degree, and you can use that information to help you support how the physiology is breaking down, and often that will improve the immune system, the immune function, and ultimately the overall condition. Okay, so that's what we're going to talk about here. So on the slide that I have on the screen, and if you're just listening via audio, I'm going to do my best to walk you through it. On the slide on the screen, I have a box in the center, and it says Hashimoto's autoimmune reaction and hypothyroidism. Okay, so you're going to see that there are things that from this box, we're going to have arrows going out to things that the thyroid will influence, and then you're going to have things that are coming back to the thyroid that will then have influence in turn on the thyroid. So again, this is we're talking about relationships here of these systems. So we're going to talk about how Hashimoto's in the autoimmune process, and the thyroid function, the hypothyroidism, has an impact on various functions and systems, and how those systems then have an influence on Hashimoto's and the thyroid. Okay, so what I've done is I've broken this down into different, basically grouped a lot of things we're going to talk about into different systems and interconnected systems, so that you can visually make more sense of it, okay, and it's easier to understand. So the first system that I want to talk about really is the gastrointestinal tract, its influence on the immune system, and how that affects Hashimoto's and food reactions and expanding food reactions. Okay, so on the screen, there are arrows that go from Hashimoto's autoimmune reaction and point to some text that says intestinal permeability, and or the lay term for it is leaky gut. Intestinal permeability and leaky gut. So if you have a low thyroid, for example, it impairs and can influence the ability of the intestinal lining to regenerate. That can lead to the intestinal barrier becoming leaky or having increased permeability. And what that does is that allows macromolecules. So a good example are food proteins. As when you eat food and it comes through the stomach into the small intestine, as it's breaking down with enzymes, with stomach acid, and with digestive enzymes, it gets broken down into smaller and smaller pieces. Now, proteins, or think of it as a chain, and each link in the chain is an amino acid. So enzymes cut the links of the chain. Now, when the enzymes start working, they don't cut all the links at one time. They'll just cut a few links, and then they'll further break down the protein into smaller and smaller pieces until you get the individual links that are all clipped or broken, and those are amino acids. But between when the food protein starts digesting to when it gets thoroughly digested into amino acids, the links that get cut, you have partial proteins, which we call peptides. Now these peptides, they can, when the gut is leaky or permeable, pass through the intestinal lining into the bloodstream before they should be there. This triggers an immune response, and the immune system will make antibodies against those partial proteins. This will cause you to have increasing circulating antibodies against food proteins, and these food proteins may be able, these antibodies that are made against these food proteins may be able to stick to your own tissues because of mimicry, because the food protein has a similar structure to some of your own tissues, because a lot of your tissues are made of proteins. So if those food proteins in the proteins in your body that make up your tissues have a similar sequence of amino acids, their structures similar, the antibodies that were made against the food may be able to stick to your tissues, triggering autoimmunity against your tissues. Now, the similarity in how your tissue looks and how the food protein looks is called molecular mimicry. The process through which an antibody made against, let's say, gluten could bind to, let's say, your thyroid enzyme is a process called cross-reactivity. These are terms used in immunology. So cross-reactivity and molecular mimicry is the mechanism there through which it might induce autoimmunity. So Hashimoto's in a hypothyroid state where the thyroid's low, or where there's high inflammation, and that causes your cells not to be as sensitive to the thyroid hormone through dampening their cellular response, which also occurs, then the intestinal lining may not repair itself as well. When that occurs, now if you look at the screen again, we refer back to the screen. Let's see if I can get the pointer here so that I can guide you visually. Okay, so the intestinal permeability leads to greater and greater reactivity to food proteins, and this is called loss of oral tolerance. Now, when you start to lose oral tolerance, this means that you're reacting to foods. You're reacting to more and more foods in your diet, and this means that you can eat less and less foods without having a reaction to them. Now, some reactions are very obvious. Other immune reactions to foods are completely asymptomatic. But if you check the blood, if you measure antibodies in the blood, if you can do specialized testing that will look, the good way to do it is to look at true food allergies, food sensitivities, and food complement protein reactions. At least that's what I think. And that's a great way to assess the immunological response to these food proteins, and you can get kind of a unique fingerprint for yourself. Now, food proteins are just one of many triggers. There are pathogens that can trigger this, that can trigger autoimmunity. There are chemicals, but we're focusing on the food component here. So you start to lose oral tolerance, which means your microbiome changes, the bacteria in your gut, and you start reacting to more and more food proteins due to this intestinal permeability. Now, when you lose this oral tolerance, I mentioned that the immune system makes more antibodies, and these antibodies can react through this concept called molecular mimicry and further drive the autoimmune process. Okay, so if you have access to the screen, I'm drawing on the diagram as we go as well. So the other thing that occurs here is that when we're talking about the gastrointestinal tract, remember I said that this particular section that we're talking about of the diagram here is talking about the GI tract, its relationship to the immune system, and foods, and the autoimmune process. That's what we're focusing on first. So the autoimmune process and the hypothyroid state, so again, low thyroid hormone or just high inflammation, causes decreased thyroid hormone response, which in the cells of your body would create a hypothyroid-like state, even though thyroid hormone levels are normal. That's really important to understand with Hashimoto's. A lot of people say, well, it's not my thyroid's good. Well, your thyroid hormone levels can be great. The production level can be great, but the sensitivity level is not going to be great if the inflammatory load's higher. And that's everyone that has Hashimoto's has that to some degree. So you have to focus on dampening the autoimmunity. But so what happens is the intestinal lining, remember I said that it breaks down. It can't regenerate and repair as well. So one of the components of the intestinal lining is fascinating. It has cells that are joined together that have finger-like productions. And then on top of that, there and between those little finger-like projections of the cells of the intestine, there are enzymes that are in there that help to protect and help with digestion. And then there are layers of mucus. So far, I think they've identified 3 different distinct types of mucus layers. And also within there are these things called immunoglobulins. And in particular, there's one called secretory IgA or SIGA, SIGA or secretory IgA. And this is an immunoglobulin. This thing is really amazing because what it will do is it will bind to different pathogens and things that are foreign and help to neutralize them so that they can't pass through into the bloodstream. So you want to have good, robust secretory IgA. You want to have healthy levels. But secretory IgA, when you have this continued immune response or you have these hypothyroid states, it becomes suppressed. Okay? So this is secretory IgA is everywhere you have a mucous membrane. So it's in your digestive tract. Throughout the entire digestive tract, the lining has secretory IgA. The nose and lung, your pulmonary system is full of secretory IgA. Your oral cavity, your mouth, that's all has secretory IgA to bind to pathogens. And these are secretory IgA can be thought of as like defense proteins. They like bind to things and don't let them through, but it becomes lowered. And when secretory IgA becomes suppressed, you can imagine if its job is to function as a protective defense protein, then things are going to start getting by it. And what this does is this leads to immune system messenger dysfunction. Now, I try not to be too technical, but I don't want to dumb this down. I want you to understand. I want to try to explain it in a way that I can, but I don't want to make it so it's baby talk. We're not babies. You can understand this stuff. You absolutely can, and I'm going to explain it in a way that if you listen or if you watch what I teach you, you can get a grasp for it. And I know that's true. One of the most important things you can do is to educate yourself. So when the secretory IgA becomes suppressed, you have these specialized immune cells in the bloodstream. They're called dendritic cells, and these you can think of dendritic cells in the bloodstream as immune system messengers. And what they do is they come up to the intestinal lining. So they're on the side where there's the blood and the immune system, and they come up to the cell wall of the one cell wall thick layer of the intestinal lining, and they will stick an appendage, a projection into between the cells up into the intestinal tract, and they will sample the environment. And they'll take this sample of the environment in the gut and they'll internalize it and they'll carry it to a lymph node. And in the lymph node, they will share it basically. And at that point, other immune cells get involved and they decide whether or not basically to launch an immune response. And so what happens when the secretory IgA breaks down and you start getting this bombardment of things that can pass into the bloodstream, you start to get dendritic cell dysfunction. So these immune system messengers start to dysfunction. This feeds into further loss of your tolerance of foods that you're eating. And so you start to react to all these foods, and then what does that do? That creates more and more antibodies to partial food proteins in the bloodstream. And what does that do? That makes it more likely that those antibodies against those foods will bind to your tissues and trigger an autoimmune response and even perpetuate and drive the autoimmune process. This further feeds into the tissue destruction of, let's just say, the autoimmune process driving the Hashimoto's, which could further create more inflammation and also cause lowering of your thyroid production, which in turn leads to more leaky gut, which leads to more of this entire process. This is a vicious cycle, okay? Everyone with Hashimoto's has these things. So this is a vicious cycle that we have to acknowledge and that we have to address. You can address these things and start to intervene as many ways as possible. What I do with people is when I work with people, I try to help identify the priorities of where to start intervening, because you'll see that this has a very, very broad scope of things that could be occurring. And so what I try to do is help people figure out what those are, what those their unique triggers are. Sometimes we'll do testing to help give us even more information about their situation, and that can help us to tailor our intervention and get a better starting point. But you can do trial and error things that can work too. So it really just depends on the individual. Now, the next thing that we want to talk about. So we finished the GI tract immune thyroid section that I wanted to discuss. Now I want to talk about another important part of this immune system and Hashimoto's thyroid web. And this section has to do with the brain and with brain autoimmunity. This has to do with antioxidants, which are very important for helping to reduce inflammation in the body. So these things have very strong connections. Now, all of the things I'm going to discuss, they're all connected one way or another. They influence one another, but I like to break these down into these different parts or subcomponents of this issue to help you with conceptualizing it a little bit better. So in this section, let's just start with, again, come back to the center of our diagram. We have the Hashimoto's autoimmune reaction, right, which drives up inflammation, causes thyroid destruction, leads to a lower thyroid, leads to diminished cellular responses to thyroid hormone. So you can have normal thyroid hormone levels, but the cellular response will be diminished. And it can also affect thyroid hormone conversion. So you don't convert T4 to T3 as efficiently, and that's a problem because T3 is the most physiologically active form. It's what you've got to have. So there's a lot of different ways it can affect you, right? So here in the center, we've got this Hashimoto's reaction. And one of the things that it can do is, and that it does, and there's literature that shows that people that are autoimmune, not just that have Hashimoto's, which is an autoimmune condition, but all autoimmune diseases, they have lowered antioxidant production. Okay, so antioxidants help you to diminish inflammation. They are critical with Hashimoto's. And as you've heard me talk a lot about inflammation, right? It sounds like this might be something important. You have endogenous systems. You have systems in your physiology, in your body, that when activated produce antioxidants, like exercise. Exercise helps you to produce. There's an antioxidant systems that are increased post-exercise. So there are antioxidants that you get from foods. There's a lot of different ways you can get antioxidants. Yes, you can take them as supplements, but there are many ways that they can be produced and that you can consume them in foods. So you have lowered antioxidant production, which is a problem because when the antioxidant production is lower, you cannot quench the inflammatory or inflammation that is present. So you have greater inflammation that's not being checked by the antioxidants. So here on this diagram, it shows that the lowered antioxidant production results in not being able to quench or diminish oxidative stress. Now, oxidative stress is basically just cellular damage, so damage to your cells from free radicals, which are molecules that are missing an electron. Okay, so that's probably a little bit more than we need to say, but so free radicals can just damage your tissues. Okay, so antioxidants can neutralize free radicals and help to diminish oxidative stress. And that's really important with Hashimoto's. If you can diminish the inflammatory response, we've already talked about a lot of things that could probably be improved. Now, you want to try to do this through these pathways and not just take something that forces the physiology upon the body. You want the body to physiologically adapt. You want the adaptive physiology to be in your favor. You want the body to actually be getting better and not just doing something to suppress chemistry. But in this case, the antioxidants can be diminished. Now, where this becomes a bigger problem is that the lowered antioxidants create systemic inflammation. Okay, so I'm circling it on the diagram if you're able to view. So this systemic inflammation is a problem. I mentioned this earlier, but it crosses this inflammatory chemistry, these cytokines, these proteins produced by the immune system, they're chemical messengers. It can cross the blood-brain barrier. When it crosses the blood-brain barrier, it leads to neuroinflammation of the brain. And I already said how this can lead to depression when I was talking about that earlier. It can disrupt your neurotransmitters, serotonin, dopamine, acetylcholine, GABA, glutamate. I mean, it disrupts your brain physiology. It absolutely does. It will create all kinds of issues. When people report brain fog and issues, this is one of the major mechanisms that's driving that. So when neuroinflammation occurs, this can lead to a breakdown in a very important barrier system of the brain. Your brain actually has a barrier system. It's called the blood-brain barrier. And the blood-brain barrier keeps things in the bloodstream that should not pass into the brain. Like all those antibodies I was mentioning earlier that are reactive, that were produced in the example I gave when I said that food proteins came into the bloodstream and then the immune system produced antibodies. And then if you lose tolerance, or what we call oral tolerance, which is an immunological, or a term used in immunology, When you lose oral tolerance to foods, you make more and more antibodies. All those antibodies in circulation, they're kept in the bloodstream because when the blood-brain barrier is intact. When the blood-brain barrier gets broken down, which neuroinflammation and systemic inflammation can do this, it opens up the blood-brain barrier, and those antibodies in the blood can now diffuse into the brain. Now, if there are any tissues in the brain that those antibodies might be able to bind to, because remember I said molecular mimicry, similar proteins in the body or in the brain, similar proteins that the immune system's reacting to, like food proteins, those antibodies may be able to stick or bind uh, to neurological tissues, and that would induce and trigger an immune response against those tissues, like an autoimmune response. And this is where you can actually start triggering neurological autoimmunity because of a broken down blood-brain barrier system. And this is, again, part of this is due to poor antioxidant status, right? Which hypothyroidism, will absolutely further diminish the antioxidants. But the inflammatory process too requires a greater deal of antioxidants. So antioxidants, getting them from your diet, and sometimes I recommend antioxidants quite a bit, especially acutely or in the initial stages, can be very, very important. So when the blood-brain barrier breaks down, it can lead to neurological autoimmunity. And I have here on the diagram, neurological autoimmunity, thyroid peroxidase antibodies. I said this earlier. They have been shown in the literature to bind to cerebellar tissue. So you can get cross-reactivity against the cerebellum, starting to react to the cerebellar tissues, which is terrible. It is terrible. When you lose neurological tissues, it is very, very difficult to make recovery. They don't go through cellular division and mitosis like the rest of our cells do. You can, if you're fortunate, you can get more neurological branching and through plasticity, what we call neurological plasticity, where they make new connections. But you don't want to lose you don't want to lose nervous system neurological tissue. So that can lead to this autoimmunity against the brain. And then if you have gluten antibodies or to antibodies to different parts of the gluten protein, which is in wheat, it has been shown to cross-react and bind to something called tissue transglutaminase 6 in some people. Now, tissue transglutaminase 2 is known to be the target enzyme that the immune system reacts to with celiac disease, which is an autoimmune inflammatory bowel disease of the small intestine. If you've probably heard of that. People that have celiac, they eat gluten and they have an inflammatory reaction in their gut. Well, there are other transglutaminases that are so similar to transglutaminase 2 that the immune system can also react to them. It's just celiac disease in another area of the body. Okay, so tissue transglutaminase 6 is in the cerebellum. So those antibodies against the gluten may be able to bind to the tissue transglutaminase 6 in the cerebellum. In the skin, you have tissue transglutaminase 3. Now, that means that there's a condition called dermatitis hepatiformis, where you get blisters like on your palms of your hands and your feet, and that can be basically like celiac disease of the skin, where you're having the same immune reaction against an enzyme that's very similar to celiac, but it's in the skin. And then you can have 1, 2, 3, or you could have all of these happening at one time. Now we do a panel. I'll often run a panel, Cyrex Labs Array 3X. It's the gluten and autoimmune panel, and it checks all those tissue transglutaminase 2, 3, and 6, and it also looks at very extensively at the most thorough test that you can get for different ways that your immune system can react to gluten proteins and non-gluten proteins that are still part of gluten. So it's a fantastic test. That's Cyrex Labs Array 3X. That's a great test because you're not going to get these tests done conventionally. You never see it happen. I've worked with a lot of people. It just doesn't get done, and it's okay. Your doctors just don't know about some of this stuff, and they don't have access to the same labs. So because none of these labs are covered by insurance, it's just the conventional medical model has not caught up to this yet. It needs to, but we have to have all new doctors that do this kind of work. There are no doctors that specialize in this at all. That's So it's important to understand. So anyway, this neurological autoimmunity and stuff feeds back into the autoimmune process. So this is a really important part to understand. Now, let's move on to the next part of the um, the next part of our diagram here. So the third section. So if you're watching on YouTube or the video, that I'm getting ready to expand to another subcomponent of this Hashimoto's and immune system interconnected web. This has to do with leaky lung or leaky sinuses. Basically, this is where, again, the barrier systems break down. You're going to see that I talk a lot about immune barrier systems. I talk about the intestinal barrier breaking down, called leaky gut or intestinal permeability. And by the way, leaky gut and intestinal permeability, all these concepts I'm discussing with you about broken down barrier systems, they are scientifically validated. Go to PubMed and type in intestinal permeability, and you'll find hundreds of papers on it. It's not some kind of esoteric woo-woo concept. This real science behind intestinal permeability and a lot of the consequences that come from that. All of the barrier systems can break down. So the lung barrier can also break down. And this is something I alluded to earlier when I talked about the secretory IgA, that surface protein. So the lung and sinus permeability, when it breaks down, due to whatever, like exposure to pollutants in the air, smoking, you name it, anything that's going to, breathing in some type of fumes, there's many things that you could breathe in that would break it down. Also, physiologically, you could have the same kind of issues with like hypothyroidism, right? So our diagram again in the center, hypothyroid, Hashimoto's immune reactivity. If it's low and diminished, the barrier systems don't repair. So we could use that as an example. So poor thyroid physiological stimulation of the lung barrier, the lung lining, uh, induces or creates a scenario where the lung can't repair as efficiently, and it becomes permeable. So it lets things in the air pass through into the bloodstream very easily. This can lead to loss of chemical tolerance, reacting to chemicals. So do you have this problem, or do you know someone that has this problem where they walk into a building or they smell something really like a strong scent, and it immediately they feel sick about it and they're like, I have to get out of here, or you know they smell like perfumes or air fresheners and stuff like that, and they immediately have a response. They could literally be having a response to the chemical, and they just know, and so they know they're going to have a headache or feel terrible, and so they leave. So they're losing chemical tolerance. Now I'll say this: I don't think I have leaky lung, but I don't like really strong colognes or perfumes or very strong smells either. I tend to do okay with like essential oils, but I don't do well with perfumes and artificial scents and stuff like that. It does bother me, but there are some people that are very sensitive to this, and this can be a sign that they have a broken down lung barrier. Now, another thing that you can do is you can take a deep breath, maximally deep breath, and inhale as strongly as you can, fill your lungs maximally, and breathe out forcefully, and all the air out, and then breathe in again, full inhale, maximally breathe out forcefully. Do that 3 times and see if you cough. If you cough, you may have a problem with your lung barrier being compromised as well, because you're able to irritate it with maximal breathing. If you have exercise-induced asthma, or if you have asthma, you for sure have a leaky lung. So this is an important thing too that can feed into the inflammatory response, drive the autoimmune process, lower the thyroid hormone, increase inflammation, diminish the cell's responses to thyroid hormone, and it leads into its own vicious cycle. Okay, so again, immune system interconnected web with Hashimoto's. Let's go to our last component here. Our last component is a very important one, and this is the relationship of Hashimoto's, the autoimmune reaction, and hypothyroidism to your overall immune system function. Now, this is just, this can lead to immune system suppression. I'm going to explain how this can occur. So, with Hashimoto's, if the thyroid's low, again, I don't want to repeat myself too much, but if the thyroid's low because of the autoimmune process, if inflammation's high, we know it disrupts the body's response to thyroid hormone, and it also disrupts the amount of thyroid hormone that can be produced, right? So, and we know that when thyroid hormone is low or thyroid responses, because of inflammation being high or a poor conversion of T4 to T3 because of this autoimmune process, it can cause these hypothyroid-like responses, even if the quantity of your thyroid hormone is normal. And that has negative consequences to every cell and tissue because every cell and tissue needs thyroid hormone to function normally. So one of the things that can happen here is when the thyroid goes low like this, it can lead to macrophage dysfunction. Now, this is an immune cell. Macrophage is a type of immune cell. And these immune cells have, very important functions. And when the thyroid hormone physiology is low, these cells can dysfunction. Did you know that your immune cells, the blood cells, the ones that are circulating in your blood, they literally have receptors on the outside of them for thyroid hormone. So when the thyroid hormone binds to the cell, it stimulates the cellular metabolism and energy production so that the cells can carry out their physiological processes internally. Now, if it doesn't have thyroid hormone, it's not going to function properly. And so this can lead to immune cell imbalance or dysfunction. Now, when immune cell dysfunction occurs, this can lead to a depressed immune system, and so depressed immune function. Now, depressed immune function is something that we would technically would probably a good definition would be when your white blood cell count, total white count, is somewhere like below 3.5, maybe 3.25 or lower. So your total volume of those cells is depressed and low, and this can be this can be part of that pathophysiology. Now, what this does is when the immune system is suppressed like this, the white blood cell count, it can lead to and make you more prone to infections. And we know that bacteria, viruses, fungi and parasites, as far as infections go, are all potential triggers and drivers of the autoimmune process. They not necessarily Hashimoto's, but they can drive the immune response, and they are for sure. We know that many viruses, lots of bacteria, lots of parasites, different fungi can trigger and drive autoimmunity in all kinds of tissues throughout the body. So it makes you more prone to infections because the immune system is suppressed. That further leads into the potential for driving the autoimmune process and creating more problems for the thyroid, which then feeds into this whole process again. So this also leads to a T cell imbalance. Now, this is an important thing here. Is a T cell imbalance means that you have poor immune system regulation. T cells orchestrate the immune response. They help when inflammation is needed, they produce inflammation. Once whatever's been targeted is destroyed by the immune system, they help to resolve and suppress the inflammation and bring the immune system back to a surveillance baseline. When you have this type of immune dysfunction, you have a dysfunctional immune response, and this can all feed into problems that drive the autoimmune process. This is why you have to address the autoimmunity. You cannot simply just say, I'm going to take thyroid hormone and that's going to be it. Now, I get it. You might have other things that are going on in your life that are reasons why you don't address, you don't try to or follow my recommendations here. But I'm telling you that there are a lot of consequences. You need to prioritize this because I think that addressing the issues that I'm sharing with you here can help you to have a better life overall. If you're tired and fatigued and worn out and you don't have the energy, well, if you can muster it, if you can stay focused for 30 days and follow it like an elimination dietary protocol, try some different things, you might be able to get enough energy that your quality of life is significantly better. So I know everyone has different situations, and so I don't I understand that. So hopefully this helps you to get a better idea. Now, there's a few more things we need to talk about. You need to understand that whenever I'm talking to you about this immune-based, basically looking at Hashimoto's and dampening the autoimmune process, it's through this this functional immunology lens. So functional immunology is basically, working with the immune system to try to support it, try to dampen in the case of autoimmunity, detect the triggers, remove the triggers, repair the damage, repair the barrier systems that have been compromised, improve immune system regulatory function, so we don't have, that immune dysfunction component we talked about. And this is definitely easier said than done. The important thing I want you to understand, though, is that there's a model for this. This is called the environmentally induced model of autoimmunity. This is a model that was developed by immunologists. It's a fantastic way to approach this. This is the model I use to help the clients that I work with develop a roadmap. So there are three major components that overlap. This is a Venn diagram for those of you listening to audio. So it's three circles. They intersect in the center. In the center, they converge, and there's another circle, and it is labeled environmentally induced autoimmunity. So there are these three general categories of things that overlap, and when they overlap, the environment is such that it may be enough to trigger environmentally induced autoimmunity. So these three areas that we need to address: number one, are broken barrier systems. Now, I just talked a lot about barrier systems. I talked about the intestinal barrier system. I talked about the lung and nasopharynx barrier systems. I talked about the oral barrier systems. I talked about the blood-brain barrier. These barrier systems are critical to keep things out of the body that shouldn't be there, because when those barrier systems break down, the immune system goes haywire and it starts reacting to everything. And this is a great way to trigger autoimmunity. So we have to assess the barriers, and we have to heal the barriers, or do our best to heal them. The second thing are environmental triggers. Now, when we talk about autoimmunity, there are three major categories of things that have been identified as triggers. Partially digested food proteins, which we talked about a lot. Pathogens, which I talked about, which are bacteria, viruses, fungi, parasites. And I'm going to release a video in the next day or two on SARS-CoV-2, and how research has shown that antibodies produced against the virus, different components of the virus, in a research paper, showed that it has been implicated in autoimmune potential reactivity against 28 of 55 different human tissues checked. That's a lot. That the antibodies made against the virus may be able to bind to a lot of human tissues, which could be a trigger for autoimmunity in those tissues. That just is a little hint. I think personally that is one of the major drivers of what we're seeing for long COVID, that it's actually early onset autoimmunity that's just not being detected, which I think there are other physiological processes too, but I think that a lot of it is early onset autoimmune disease. So that needs to be screened with multiple tissue antibody panels. Cyrex Labs Array 5 is the one I would use. So environmental triggers: foods, pathogens, and chemicals. Chemicals can be really serious. I think this is probably a major area that's being overlooked, that does not have any of the recognition it needs. We're hearing about stuff like the PFAS, the PFAs, that are these forever chemicals in the water supply that are everywhere in the United States now. They're all around the world. These things, and there are many. There are 85,000 chemicals used in industry and agriculture, and the vast majority have not been really tested for human safety. And this is because the industries put it on the companies to the companies manufacturing them to test them for safety. And it's just like, what's their incentive? That's not the way to do it. But in any event, chemicals are a huge problem. I have done many videos on chemicals as well. I don't want to digress further into that and go into too much detail, but environmental triggers are a huge part of this environmentally induced model of autoimmunity. So I like to test for antibodies against all those things if we can. There are other tests I might do as well to give us a more clear picture and starting point, but these are things that we want to consider. Now, the last circle here is immune system dysfunction. We talked about that some already with the suppressed immune system, dysfunctional macrophages, dysfunctional dendritic cells, dysfunctional regulatory T cells that regulate the immune system. So deficiencies, any type of vitamin or mineral deficiency, but primarily things like vitamin D, essential fatty acids, magnesium, selenium. I mean, any of the fat-soluble vitamins, but the big ones I mentioned, Vitamin A is really important for the barrier systems to heal. Vitamins E and K are important. I mean, there are so many, critical. You don't want to be deficient in things. I mean, that's an issue that can lead to immune dysfunction and create problems for physiology. Chemical exposures can create all kinds of problems that can lead to immune dysfunction. Chemicals can disrupt hormone production, hormone signaling. It can um, they can directly bind to your blood, to your white blood cells, and cause dysfunction of those cells. Chemicals have many different ways to create problems. Carcinogenic, bioaccumulative, they do a lot of damage potentially. Stress is also can lead to immune dysfunction. There are other things too, but stress can drive your autonomic nervous system and put you in a state of fight or flight, so that you're under chronic stress, which I think is a huge epidemic that's not recognized. That's why I recommend, if you have budgets for it, there's all kinds of different things that you can do, but I recommend, biometrics tracking devices like Garmin watches, Apple watches, the Samsung watches. As long as they'll check heart rate variability, they'll measure blood oxygen saturation, they'll track your sleep at night, track your movement. Those are all great options. Some of the rings out there's the Aura ring. There's Samsung's coming out with a new one that looks really cool. There's one called Ringconn, Ringconn. That's a good one. There are several different biometrics tracking devices that can help you to measure your heart rate variability, which I think is the best proxy, the best way for you to look at recovery and overall stress. And it's a good window. So that is the overall model of autoimmunity that we use and that you should be thinking about too. So now what can you do? The next things that you might want to consider doing. So be proactive. That's the first thing. Just start thinking about this stuff, learning about it like you are now, and then take some action. So regularly check and monitor your thyroid levels. Get a TSH level done quarterly. Don't wait a year, and don't ask your doctor if they say, hey, I can't do that. Say, hey, if I pay for it out of my pocket, every quarter I want to get it done, how much would it cost? And if they say I can't do it, then just say, okay, I'm going to go to a hospital, or I'm going to go to an outpatient clinic, and I'm going to get a standing order so I can just go in and order it myself, because that should be pretty cheap to do. I mean, really, it should be cheap to do, and you can do it outside of insurance. I mean, a lot of this stuff that I talk about has to be done outside of insurance. They just won't pay for it. There's no coverage, unfortunately. But there's stuff that you can do. I'm going to tell you about that. So it's not like all is lost. I don't think by any means that all is lost, but there's a lot you can do. Second thing to do, embrace lifestyle and dietary changes. The diet that I most commonly recommend when I'm doing trial and error, when we don't have any testing to help give us a little bit better starting point, I recommend the autoimmune paleo diet. Now, if you check out the description of this video, I have a link there, and I will give you the dietary protocol, like a 14-day protocol that you could repeat if you needed to. Now, obviously, check with your doctor. I can't give you medical advice because I don't know your unique situation, but the autoimmune paleo diet's one I use a lot. And the 14-day protocol, you can go click the link. It'll take you to a website that will explain that you can, if you opt into it, it's totally free. You can get access to our app that we use to track people's health. I mean, it's a fantastic app, but within there it has shopping lists, recipes, everything that you will need. It also has the dietary protocol in a PDF document. So it's great. It's totally free. You can go get access to that. I think it's a good place for a lot of people to start, or just start exploring and looking at ideas. And I do have supplementation that's loaded in there that would be a um, it'd be a pretty good foundational supplementation protocol if we were just doing trial and error. Now, obviously, when someone's doing trial and error, if you're doing self-help, self-guided, I don't know anything about your health. If I know about your health, I can tailor that more specifically. If we have testing, I can tailor it very specifically. But it's still, I have that supplementation protocol loaded in there that you could purchase if you wanted it, but it's totally optional. The last thing is share your journey with us. Let us know if you have questions, if you're stuck or you have a challenge, message us, post in the comments, and I do my best to answer those questions with useful information. So I do my best there. So just ask, and we'll help. We'll do my best to help you. And then lastly, if you need help, you may want to consider consulting with me via telemedicine, and you can learn more about that if you go to my website. It's drbrad.com, shook.com. It's drbradshuk.com. Go to our application for care page. I'll put a link in the description below the video too if you want to go check that out. I have information there on how it works. We work with people via telemedicine around the world, mostly in the United States though, because we can work with you there. Its testing is easier and stuff. It's very difficult overseas. I've tried that many times and we've been able to work it out, but it can be a real challenge, just depending. And take a look at it and see if if that's something that you might want to consider. But I hope this has been helpful. I really appreciate you spending all this time with me. I hope you've learned a lot, and if you have questions, please ask. If you are trying to consider something to do, check out that dietary protocol and get it. It's totally free. We're not going to spam you. I have an email list. I never send emails. I just don't do it. So join us here. Ask questions if you need it, and we'll go from there. But hope you have a wonderful day. Talk to you again soon.